to ayahuasca seeking a new treatment tool, but then I came out of it with a lot more than I bargained for. It really blew my mind and my heart open to spirituality and all that we can't explain and can't see. When you heal from one thing, like trauma or PTSD, so many other areas of your life change as well. Relationships improve, parenting changes for the better as one heals and grows, and even the communities start to thrive as individuals do their healing work.
It simply unfroze me from seeing things the way I had been programmed to see them. You know, I'd been programmed to see reality through a tunnel. Suddenly with LSD, I could see other realities. I said, oh wait, this is just a tunnel, one of a number of different tunnels. And hey, would it be possible to even go through life successfully without a tunnel? It's possible.
So it could be old trauma, more recent trauma, battlefield trauma. Across the board, MDMA-supported psychotherapy is good for all those different types and styles. And when you look at those efficacy rates, that means 67 to 83% no longer meet criteria for PTSD. And you compare that to the standard of care, which is talk therapy and psychopharmacology or pharmaceuticals, that's like 30 to 40% improvement rate. 30 to 40% improvement rate versus 60 to 80% cure rate. I mean, orders of magnitude different.
Here we are, episode 7 of our 9-part docuseries, Psychedelics Revealed. What, as the Grateful Dead said, a long, strange trip it's been thus far. We're kind of rounding that home stretch for episodes 7, 8, and 9, and we're excited to share those with you. In this particular episode, you're going to learn some new things, some different things. This is a vast world. The scope of it is pretty wide, which is why we spent so much time, so many interviews. And there's also continuity that's a part of this. Being able to track people through their experiences over time, I think, is something that is necessary to really understand the impact of psychedelics on people's lives. So it's great to be here with you. We're coming into the home stretch. And just a reminder, we're in the free viewing period still. So if you haven't already invested in Psychedelics Revealed, right on this page, you can look at the varying packages we have, you can look at the bonuses we have, you can see how steeply discounted it is right now. This information is something that I believe you should want to own. And I think we've put together some really attractive packages for you to own it, feel good about it, feel like you got great value. And in the meantime, it supports our work. So thank you for being here. Thanks for being this deep into this journey thus far. And let's jump into episode 7. Next up, we have Dr. Reid Robison. He is an important individual to hear from because he's a coordinating investigator for MAPS. You probably heard about MAPS and the research they're doing. It's the Multidisciplinary Association for Psychedelic Studies. It's an important organization that most people in the psychedelic world know about. In addition, he's got expertise working with people clinically, so this is a little bit more in the clinical and research side of things when it comes to psychedelics, and he's someone who's got a vast amount of experience here. So this is an important interview to help you understand what's going on more on the clinical and academic side of psychedelics today. Enjoy this interview. Reid, thanks so much for taking the time to sit and talk with us.
Thanks for having me.
So talk a little bit about your background, your academic background, and professionally the type of activities that you were doing and are doing today.
Sure. I'm a psychiatrist focused on finding new and more effective ways of addressing difficult to treat mental health conditions, and especially focused on the therapeutic use of psychedelic medicine and the therapies that go along with it.
How long have you been focused in that area?
Several years. My first entrance into this area was working with ketamine starting about 9 years ago.
And what is ketamine?
Ketamine's an interesting medicine in that it was first approved decades ago as an anesthetic, but also has psychedelic properties. So today we use it as a rapid antidepressant and also as a psychedelic medicine and tool for therapy.
So when you say psychedelic medicine, it maybe has a more specific kind of definition, coming from a psychiatrist as compared to maybe the general lay public. So maybe you can talk about that.
Sure, yeah. I like the term quite a lot. It means to wander in the mind, and that's what I see us doing with these medicines, is going to those dark corners of one's inner world, shedding light on the things that make us tick and behave in a certain way that we might not be aware of. And just as we bring that to light with more awareness, we can move forward with a new path, a more conscious path forward.
So were you practicing psychiatry before you were getting involved in psychedelic research?
Yeah, I started my career after training at the University of Utah. I joined the tenure track academic faculty there and did clinical trials looking for new ways to treat psychiatric illness. And also I had a genetics lab trying to understand what's underneath these, or what leads up to the neurobiological basis of mental illness. And from there, I got a little bit exhausted at the slow pace of academic research and grant funding. Very important work and important source of funds, but I just was impatient and left to do research privately, where I felt I could do it quicker, and also to pursue some more clinical experiences. And so from there, I headed up a psychiatric consult service at Utah's biggest hospital, and really got hands-on with people's struggle and how the tools we have currently just aren't working well enough. We've been doing the best we can, but there's so much more work to do. So that led me into the psychedelic medicine research.
Were there any particular types of mental illness that you were focused in, or was it just a broad base of many different things?
Yeah, I'd say the main category is difficult to treat mental health conditions, starting with what some call treatment-resistant depression. I don't love that term, but depression that isn't responsive or doesn't respond adequately to traditional treatments. And the next category would be trauma. Worked a lot with those who had been through very difficult, horrific things and were struggling to get their life back afterwards. And then I'd say the third main area of focus has been eating disorders, working with anorexia, bulimia, and the other eating disorders, which are some of the most difficult to treat, and anorexia being the most deadly of all mental health conditions, actually.
Is it really? I didn't know that.
Yeah, with a rate from both the medical complications and cardiac complications of malnutrition, let's say, that makes it even scarier than, say, depression.
So, being that you were looking at, for a neurobiological basis with these psychiatric conditions, sort of like a tough thing saying, okay, I guess the first question is there a neurobiological basis for it, or is that just an effect, not a cause? So, what did your research show for you?
Well, it's a really good point, and as I went through my education, I remember hearing this debate about nature versus nurture. But as I dove in deeper and worked more and more in this field, I realized that it's not nature versus nurture. It's not even one or the other. It's always both.
Right.
It's nature and nurture. So we all have this, say, neurobiological deck of cards we're dealt that makes us who we are to begin with. But then environment on top of that is huge. So if we look at any given mental health condition, you can put an estimate on, say, the heritability of that, the percent of your risk of getting that's attributable to either genetics or environment. And all of them have a genetic component, some more than others. Like autism might be on the higher end of that genetic spectrum, and something like depression might be lower than that, but still up there, usually more than 50% attributable to genetics.
And what about eating disorders?
They're up there as well. 50 to 70% of it is thought to be attributable to genetics, but with eating disorders, it's an interesting phenomenon where your genetic risk of getting the condition can actually be a positive thing at first, but in the perfect storm of societal and cultural factors, can lead to the development of an eating disorder. For example, if you have a drive for perfectionism, a little baseline anxiety that can serve you well in life, but in the face of a traumatic life event or a series of, say, extreme diets, you can get kind of pushed over the edge into patterns that are very difficult to pull oneself out of, like restrictive eating or obsessively concerned about food and body.
What got you into psychedelics then? So here you were, you're kind of in the university-based setting, the academic setting, research setting, and then frustrated with the pace.
Yeah.
So you move out, and then how do you find psychedelics?
Well, I was working in psychiatry with the tools we had at the time that frankly just don't work well enough. It was frustrating to see that, say, half of people who would try a given antidepressant just wouldn't respond well to it. And even when they did, it would take a while, sometimes weeks, that we didn't have. And when ketamine came along around 2010, I just watched with so much interest when the first study or two came out. Here was a medicine with a completely new mechanism compared to what we were using, and that worked rapidly. And as I began to work with it, as I embraced it, saw that it brought about this non-ordinary state of consciousness or psychedelic experience that could be transformative in and of itself beyond just helping with someone's depression rapidly. So I dove all in and started using it clinically, started doing studies.
So what's interesting, because you talked about some of the traditional pharmacological approaches, it could be a while before they start to have any impact. So is ketamine immediate? It's like an immediate experience? If I were to walk in and let's say you viewed me as a patient and said, I think I want to use ketamine here, walk me through what you would do.
Well, after a very thorough evaluation about your story, your background, and also your medical history, making sure there isn't something that says we should not use ketamine or that it would be unsafe, medical and psychiatric history. If we decided together to proceed with that as a treatment tool, the data after a decade of research, tens of thousands of people getting the medicine, it looks as though 70% of people at least will have a rapid response in their depression, a rapid improvement. The thing is, it doesn't always last. That's where my recent focus on the therapy that goes with it comes into play, is we'd see an improvement in most people for a week or two, maybe a few months, but without the therapy along with it, things would snap back into place.
So tell me what I would experience as a patient. So is it injected, and then how long, and do you sit with me? I mean, how does this all work?
Yeah, no, it's a good question. We can use it, and we can and do use it in several different ways. The early studies of ketamine for depression gave it intravenously or through an IV that would just drip slowly over 40 minutes was a typical protocol at a very specific weight-based dose. After we as a field, as psychiatrists, got comfortable with doing it that way, we realized that we could give it in a shot, an injection, and not have someone tied to that IV tube coming out of their arm. In less of a setting that felt clinical, we could take them away from that IV that ties them to reality, let them relax into the experience. So I like to give it by IM injection or intramuscular injection, usually in someone's shoulder. So you would come in, sit in a recliner in office after checking your vital signs, checking in with you, setting an intention, let's say. We'd give you headphones, music, eye mask. I'd inject you with ketamine, and for the next 45 minutes or so, you'd go on a journey in your mind, and then afterwards we'd debrief and try and draw some wisdom and insight from that.
Wow. So what would that journey be like? Is it very different for everybody? Is there any commonality amongst people?
It is both very different for everyone, and there's a common signature for each psychedelic medicine, ketamine included. Ketamine is pretty fast in terms of how quickly it comes on. It feels like you're blasting off to outer space for many people. There's a sense of kind of melting into the room, into the chair you're sitting in. And then you leave your body for a moment. At higher doses, your ego structure, your sense of self even dissolves, and you become one with these surroundings that you're kind of flying through or swimming around in. And some people revisit parts of their life, people, places, memories. And with this medicine on board, because of its calming nature and because it gets you out of your body that has these physiologic responses, you can revisit old traumas without the same fear response and work through some of these blocks that previously kept people stuck.
And as soon as somebody comes out, let's say somebody comes in who's severely depressed, maybe failed in other treatments, they have this first 45-minute experience with ketamine, they come out, do they immediately feel differently?
They usually immediately feel calmer, and ketamine can and often does induce a mystical type experience or even a spiritual experience, like most psychedelics can do. And that can be dramatic in the way a person sees the world even immediately after coming out of that experience. They can be changed forever.
So you're a psychiatrist, and obviously with an academic and scientific background, and now you're talking about spiritual experiences being introduced through these mechanisms. How do you navigate those waters where you kind of maintain sort of your objectivity around looking at the neurobiological basis of psychiatric disorders, but at the same time saying, somebody's going into a journey, they're having a mystical and spiritual experience, and they come out, and it could change them forever. So how do you think through that?
Yeah, it's a good question, and I've had to come to terms with that through my own journey over the years, because I did come into this with a very scientific mind, firmly based in evidence-based medicine, and along the way I've had to put my own ego aside and realize that we don't know everything, we can't explain everything, and there is something powerful about connecting with your spirituality or something greater than yourself, and incredibly powerful for one's healing journey too.
Wow. So how long has it been now that you've been working with ketamine?
About 9 years.
Are there any other psychedelics that you work with?
Yes, currently I'm working with ayahuasca and MDMA as well in research settings and clinical settings where it's legal in other jurisdictions.
So, let's do one at a time. Let's talk about ayahuasca.
Sure.
So, what got you started in exploring ayahuasca, and then if you could describe if you had any personal experience with it, and then how you look at it as a clinician also.
Sure. Yeah, I've been intrigued by ayahuasca for several years, but really got to know it about a year ago when I first worked with ayahuasca in a retreat setting and had my own ayahuasca experience leading up to that. The group putting on the retreat said, well, it's not required that you have your own experience. We pretty much say you need it. You should have your own experience to be able to work intimately with the medicine and with the people going through that experience. So I did, and I went to ayahuasca seeking a new treatment tool for the individuals I work with. But then I came out of it with a lot more than I bargained for. It really blew my mind and my heart open to this other side of the coin of spirituality and all that we can't explain and can't see. So I've been intrigued ever since, and doing studies both with the individuals we work with in these retreat settings, but also interviewing ceremonial leaders and shamans who've worked with this medicine for decades to try and learn from their insights and blend our Western scientific approach with their spiritually based tradition of using this medicine.
So what's interesting is, you say it blew my mind and my heart open. It's not like just, you have this new awareness in mind, but it sounds like you can't separate what happened for what you would characterize as your heart.
Yeah.
So when you say that, like I say, something's mind-blowing, I think we kind of get a sense of that. But when you say blew your heart open, what do you mean by that?
Yeah, it's funny to talk about the heart in these two ways, because having gone through medical school and traditional medical training, I've looked at plenty of hearts while they're beating, say undergoing surgery, and I don't see with my eyes a glowing spirituality around it or spinning green light as we describe it in a Hindu chakra system, let's say. But in other cultures, they talk about the heart as more of the center of your feeling body, the center of one's spiritual being. In China, for example, there's one word that combines mind and heart into one concept, and I think we're lacking that here. But when I talk about the heart that way, it's in more of the center of one's emotional body,
Right.
and even our spiritual center.
So did your personal experience with ayahuasca, did it change your effectiveness as a psychiatrist treating patients?
I think it did. I think I was, with my mind and my heart blown wide open. The next morning or sooner, I had this renewed vigor, this presence that I didn't have before, and I could just connect with the other person on a deeper level so much easier and feel what they were going through. And in the week that followed, I shed many tears with the clients I sat there with as I heard their stories, and felt like I was really in it with them. And I do think that added to my abilities in a dramatic way to help someone on their journey.
Did patients that were existing patients that were with you before and after, did they notice a change in you?
I think so. When I came back from an ayahuasca experience, it was similar to after I'd gone through, say, a 10-day intensive meditation retreat where friends and colleagues would comment on, wow, your energy feels different, you feel so present, you feel so grounded. And I did feel like I was just more connected with not only myself, but those around me and the earth, the rhythms of the earth, the natural way of being. And I do think it was noticeable. The other thing that happened coming back from ayahuasca is I just said to myself, I don't want to give these other medicines I work with, like ketamine, without adding ceremony to it, like they do in ayahuasca. So making sure there's enough time and space for preparation and integration afterwards, going into all these things with intention and purpose and a sense of sacredness about it.
So that gets very interesting now, because when I look through the lens of traditional medical researcher, and you start talking about ceremony and intention, variables that I guess ceremony you can kind of control. Intention, I guess there's been studies on that too. With people saying you put a certain intention on something. But now, through your experience, you're saying, well, these are essentials, I guess, to my process. It's not just a mechanized, give them a shot, lay them down, do this, but there's more of a humanistic element to it?
Yeah, more of a respect for the power of these healing modalities and a respect and awe for the power of the human spirit and the inner healing intelligence that we can harness by helping someone kind of return home to themselves and get out of their own way, get unstuck so they can really blossom into who they're meant to be or their most magnificent self.
Well, ketamine is legal and you're using it now. Ayahuasca, not so. But is there a path for ayahuasca to try to get adopted by, within a regulatory framework to be able to be used?
There is a path. I think it's a longer one than some of the other psychedelic medicines like psilocybin, for example, that's in phase 3 clinical trials for depression, or MDMA for PTSD, that will probably be the first psychedelic type medicine to be FDA approved for use in the US. Ayahuasca is trickier because it's a combination of 2 plants from the Amazon, and because a lot of the benefits of it come from not only the medicine, but the ceremonial way in which it's used. That being said, there are people studying ayahuasca for depression, for addiction. We're studying it for eating disorders. And organizations like MAPS have it on their roadmap for studying further and determining if there's a path that should be pursued to try and make this accessible in the U.S.
Yeah, obviously you're very analytical given your background. So prior to your first ayahuasca experience, I'm sure it was explained to you. This is, kind of what it does and how it works, and there's a ceremony, etc. So you had to have some sort of, preconceived notion, I guess this is what it's going to be like. How different was the actual experience from what you thought it might be before you did it?
It never ceases to amaze me that no matter how much we try to prep someone about a psychedelic experience, you can never fully paint a picture of what that will be like, and it is so unique to each individual. I've seen that so many times with ketamine and other medicines, and I experienced that in a dramatic way with ayahuasca. And I read so many papers, so many books about ayahuasca before experiencing it, but there was no way to really know what to expect until I had that experience for myself and really felt it in my body and not only my mind.
So you mentioned MDMA. What's your experience with MDMA? And give us your perspective on it as a tool.
Sure. I'm currently working as the coordinating investigator for a MAP-sponsored MDMA-assisted psychotherapy study for eating disorders.
Okay.
And so MDMA is such an amazing tool for healing from trauma and has potential to be game-changing in other areas as well. I'm really excited to see what comes of this study for eating disorders. But the data coming out of the PTSD studies with MDMA just blows away treatment as usual in terms of effectiveness. I've never seen anything shake up a field and a response rate so dramatically. Even more so, I think, than ketamine did compared to traditional antidepressants.
What do you attribute this to? I mean, it sounds like it's really earth-shattering.
It is, and it's not even a plant medicine. It's a synthetic compound that, we as a society stumbled upon through the ways of doing research pharmaceutically, but then this medicine has these unique properties of reducing fear, increasing empathy, increasing connection to others that go so far in not only the therapeutic relationship as you work with someone in therapy, but in one's life and the way they view themselves, the way they connect with those around them and their support system. So I think it's from those areas of decreasing your fear responses, tuning you back in with yourself, your emotions, and moving forward in the world in a new way.
So what's interesting is, the studies, or the way you describe the studies, are kind of disorder specific, eating disorder or PTSD or something like that. But I have to imagine that if you were to maybe expand what the influence is on an individual with PTSD, for example, that there's other aspects of their life that might be enhanced at the same time that you're not really focused on. Is that, do you have that opinion? Yeah.
Yeah, the way the healthcare system and the drug development process works in the US, for better or for worse. We study specific compounds for specific indications or conditions. But once they're approved, like ketamine was for anesthesia, as physicians, we can prescribe them what's called off-label for any other condition, as long as we're doing it in a safe way, and the potential benefits appear to outweigh the risks, and there's the right amount of informed consent involved. So once we get a medicine like MDMA approved for PTSD, that at least opens up the door to study and understand it in other conditions. But the other part of your question, I think, is even more interesting, in that when you heal from one thing, like trauma or PTSD, so many other areas of your life change as well. And even the family system, relationships improve, parenting changes for the better as one heals and grows, and even the communities start to thrive as individuals do their healing work.
These, because you talk about off-label prescription and so on, are there adverse effects, compared to, like, obviously many other medications can have these adverse or side effects, that, when you watch the commercials, they spend, half the commercial listing all the potential horrible things that can happen.
Yeah.
What about like MDMA or ketamine? Does there seem to be significant risk of adverse events with those, or?
There are always adverse effects with any medicine. And the way I like to look at it is they're all effects of the medicine. Ketamine's an interesting example in that we use the adverse effects as part of the therapeutic process, like the adverse effect or the effect of dissociating, disconnecting from oneself, or having an out-of-body experience. Traditionally, the Western medical system might try to tone that down or get rid of these side effects. But these days, with what we know about the healing potential of psychedelic-type medicines, we're using those and welcoming those in the most appropriate set and setting and with medical safety in mind. But yes, there are always side effects and potential risks to keep in mind with these, and they're not for everyone.
The research that you're doing now, how long do you think before you're going to have publication from it, and at what point do you think something like MDMA would be readily available through most practitioners?
Well, it depends on which medicine we're talking about. You mentioned MDMA, and MAPS is on this crusade to bring it to the people who need it, and it's going extremely well in terms of the research results, the funding, so they can do that. I would guess that there might be an MDMA approval for PTSD by as early as 2021.
Wow.
Or certainly by 2022 or sooner, I would guess. Ketamine being already legal and prescribable, we're doing studies to better understand how to use it, or what is the best way to pair it with therapy, and what is the right dose, the right frequency, and who are the right individuals to get it. So that research is ongoing. We're drafting some up for publication now, starting another study of emotion-focused ketamine-assisted psychotherapy, for example, that we hope to complete within the next few months.
So I'm sensing something, but tell me if this is true. In your practice prior to using psychedelics, and you've got people coming in depressed, maybe you're using an SSRI or some of the traditional medications to help support them. It'd be like, okay, I'm kind of going to do my assessment, diagnose, prescribe, see hopefully how they might report if they're feeling better, not feeling better, etc. And it's it didn't seem like there'd be like excitement around that necessarily, but it's just like a process, and this is a responsible psychiatrist trying to help a patient. I get the sense when you talk about somebody coming in and sitting down, and you're about to inject them and put them into a ketamine journey, that there's almost like a little bit more of like I don't know how to describe, maybe a childlike excitement, saying, "Boy, I can't wait to see how this one's gonna happen." Am I sensing that accurately or no?
Yes, it's very exciting as a clinician, as a psychiatrist, doing therapy to work with these tools because it accelerates the process so dramatically. If you want to understand what it's like to have a psychedelic experience or sit with someone having one, you could go have a tea party with a 4-year-old, for example, and get an idea of how fun that conversation might be about what their experience was like, how they're seeing the world, new connections they may have just made.
That's a great analogy. Really, almost like an Alice in Wonderland. Right?
Yeah.
You know, so you're heading into the rabbit hole. So with patients who have experienced this, when you're sitting, and let's say you're sitting with patients that ever had a psychedelic experience, and now here you are sitting there recommending, okay, we're going to inject you with ketamine, it's a psychedelic. Yeah, you're doing informed consent, basically. What kind of responses do you get from people?
Well, that has changed over the past few years dramatically with this psychedelic renaissance that is happening, the return of these medicines into the research world, even the clinical world. A few years ago, ketamine sounded a lot scarier. Now people are hearing about others' healing journeys and asking about it or more receptive to it. Still, if you haven't had a psychedelic experience, going into one for the first time can be extremely frightening beforehand. But looking at ayahuasca as an example, last year in a retreat setting, sitting with, say, 25 people, most of whom had not had a psychedelic experience yet, I'd say most of them had a very scary moment or two at some point during the experience where they might worry, is this ever going to end, or what is happening? But every one of them went into the next ceremony with purpose and meaning and confidence that they can do this even if it's scary, and that it's important work they're doing for themselves, their family, for their communities.
Is it typical that there's more than one journey when you go for an ayahuasca retreat, that they don't just do one but a series?
Yeah. The retreat setting that I'm referring to had 3 journeys, spaced apart with a day in between each one. That's pretty typical, 2 or 3 over a time period. With ketamine, it's typically, say, twice a week for 2 or 3 weeks. And then there's always the chance to do a maintenance or booster session several weeks or months down the road or when needed. This is decades of old conditioning, past trauma and wounds that we're working on and undoing. And even with the accelerated potential of psychedelic medicines, it's not going to be undone overnight, typically.
And do people, when they're going through, a series with ketamine, once they kind of get familiar with that space that it puts them in, do they start to look forward to it, or how do they show up?
Yeah, I'd say most do look forward to it, and especially after the first setting, once they know that they can do it, and they will come back to themselves, and there may even be some pronounced early benefits from it. So I'd say most people look forward to it. Some find it still, after many sessions, very difficult, anxiety-provoking, especially when you have a tight grasp on control in your life, or feel fear intensely from your genetic makeup or environmental background, or both. Yeah.
So with ketamine, you said you might have them come twice a week for some weeks, and then maybe even some maintenance program. How does that work with MDMA? Is it similar as far as the protocol?
It's similar in the sense that there are usually multiple sessions, but they're more spaced out with MDMA to give not only that space for the time and space for integration or making sense of the experience, drawing insights from that, applying them to your life, but also to let the brain recover from that neurochemical experience that the medicine brings on, like the serotonin and oxytocin that's released, to let your brain recover before going in again after 3 to 4 weeks typically. And with MDMA, they're usually, I'd say 3 sessions is typical in a study protocol over a few months.
And those 3 sessions seem to, at least thus far, like stick, meaning that there's sort of a permanent change that occurs?
Yeah, it's striking to me that after even just 1 session of MDMA-assisted psychotherapy, the majority of individuals who had that experience no longer meet criteria for PTSD.
Wow. So this is where it kind of gets interesting, at least, and I'm wondering what your view is. Well, we see kind of what the effect is on people that have certain mental health challenges. And, earlier on you were talking about, this sort of spiritual aspect to this whole dynamic. What about a wellness protocol, if you will? Somebody who doesn't have a particular mental health issue, is it your belief that someone can benefit from this even if they don't have a particular condition they're trying to address, but maybe just as to a life enhancement?
I do. I strongly believe that these can be used as tools for optimizing health and well-being. Where I work is within the medical system and studying compounds for specific conditions with a path towards FDA approval. That being said, I have a deep respect for and high hopes for the use of these tools beyond that in kind of ceremonial and spiritual contexts in the right way. But that's not my area of focus.
Wow. So interesting, because from a personal experience, since you've had experience with these things, do you see, I guess, the benefits of your life in general because of your use of them?
Yeah, I do. It was striking to me what happened after just a couple ayahuasca experiences to change my worldview in a dramatic way permanently. Like I just saw the world, saw another side of this coin, or saw the world in a new way. And that's persisted. You have to go back and revisit it or renew or deepen that experience, I think. But it was game-changing for me, not just with ayahuasca, but even ketamine years ago to experience that and get a sense for what it can do, what it can feel like for people. And I should add as well that you can't really extract wellness from like treating a disorder. We're all in this together, in this shared human experience. We're all on a spectrum somewhere of sadness, depression, grief. We all struggle in one way or another. And these are tools of helping to alleviate some of that, helping to reconnect with ourselves and each other on this kind of shared path home.
And it sort of, and that's, I think, a beautiful sentiment. What sort of occurs is that, and maybe kind of the distinction is that, I wouldn't find a psychiatrist saying, well, I don't have any psychiatric disorders, but I went ahead and took some of my psychiatric meds, just because, I would know what the experience is. So this is kind of a different category because it's like you can experience this, which, even though you might not have PTSD, you can still experience, MDMA, know what that is, and then somehow, I guess it helps you understand the experience of the patient. And so it's kind of a new category of doctor-patient relationship, I think.
Yeah, it is, and I'm experiencing that in real time as the world turns to these fascinating medicines and tools for healing and growth. And I just got asked yesterday by a physician colleague about how he could access some of these to better himself. And I get questions like that all the time, whether it's about classic psychedelics or these related compounds like ketamine and MDMA.
Wow. Well, this has been really fascinating to get this information through your context, based on your academic and professional background. So I really appreciate you taking the time.
Yeah, thanks for having me. It's been really, really fun to talk about. It's something that's really special to me, so thank you.
Well, that completes my interview with Dr. Reid. What an amazing guy who's doing work that can lead to breakthroughs in the future for people who are struggling with certain psychiatric and other health disorders that can be helped through this work. So I was glad that you can hear from him and the type of work that he's doing.